So today we're going to be focusing on the motor skill of gait, and Brandon's task here is to get from the kitchen into the bedroom. And you're going to notice a couple things here. Go ahead and walk Brandon. You're going to notice that he has an object in his hand, which is creating an object manipulation. So he's having to focus some of his attention. He's going to step from the tile onto the carpet, creating a change in surface, which is creating an intertrial variability. Also, he has the environment is stationary because it's not moving in relationship to him. So we have a stationary environment. We will be demonstrating 2C in Gentile's taxonomy, which is very similar to 2D minus the object. So we're still going to have intertrial variability with a change in surfaces. We're still going to have a stationary environment. The environment is not moving around us. And we're also going to have 3 different difficulties within this classification. So first, we're going to have the patient just walk with leading with his strong leg and then coming up behind with his weak, but his weak never passes his strong leg. So go ahead and lead with your left, Brandon. And then from there, bring his right weak leg up to the left and continue the same process where his right leg is never crossing in front of his left leg, creating the least amount of difficulty for this specific motor skill. So now we're going to do the same task, except this time and then lead with his strong, which is his left leg here, and then with his right leg bring his foot up all the way to the toes of his left leg, and then continue as a normal stride. Now we are in the final difficult phase of the 2C, Gentile's taxonomy, 2C classification, which is you're going to have a longer step length. So now it's going to be more of a normal gait pattern as you would see throughout your day. So we're going to have Brandon always lead with his strong leg. So go ahead and lead with your left leg there. And then with his right, bring it past this time. Not too far, but at least past, that's good. Past the length, so he's gaining a little bit more strength. And this is the most difficult stage now of this complex. So now we're going to be demonstrating the classification in Gentile's taxonomy regarding 2B, and we're going to have 3 different difficulties for our patient Brandon here today. First off, in 2B, you want to have body stability. So he's going to be standing still. He's not going to be moving around or walking in any fashion. Also, we're going to have an object in this one, and the object is going to be the laundry. So his task today is going to be folding the laundry, which will create an intertrial variability. It's going to be a stationary regulation because the environment will not be dictating on how he moves. So as you'll notice on the first difficulty phase, he's going to have 80% of his weight on his strong left leg in this case, and 20% on his weak right leg. This is going to make it the easiest for him with regards to weight distribution and the amount of fatigue his right leg will feel after a given period of time. Now we're going to upgrade him to the second difficulty, and where his weight is going to be now 50% on the left, 50% on the right, creating a heavier weight distribution on the right leg, which will increase the amount of load put on the knee there, which we're trying to gradually increase. I want 80% on the left knee, Brandon, and use your elbow as a support there, and you're going to reach with your right arm to grab that piece of laundry. So you'll notice that it's going to be a lot more difficult than if you were just standing still versus going down in a squat, creating a larger range of motion on the knee joint. 2A in Gentile's taxonomy, in which we still have body stability, so we're still standing stationary. There's no object involved, so it's just purely you standing still, and then the environment is not dictating how you move, so therefore we're in a stationary regulatory conditions, just like we've been throughout this whole rehab process. As well as there will be intertrial variability due to the change in surfaces. As you can see here, we have carpet as well as we have tile. So what we're going to do here is we're going to distribute the weight differently to increase or decrease the difficulty. So first off, we're going to have the weight bearing mostly on the strong leg, so therefore it's the least amount of difficulty for this given classification. To increase this, we're still standing on different surfaces. He's going to go ahead and distribute his weight evenly now, creating a heavier load on the right weak leg. So now you can see that both of the legs are evenly distributed. So now the final task is to have him distribute his weight 80-20 now on the opposite side. So his weak leg is now going to have 80% of the weight and his strong leg 20% of the weight. Bearing more weight on the weak leg, creating it a more difficult task to complete.
So these are the critical factors in which are needed for the movement to occur. One of the biggest things is weight distribution. It has to be equally distributed. You can see here now that there are flexible factors in which can vary, which is the speed, stride length, rate of acceleration, or the patient's arm movements. Last, we must progress the patient through different difficulties and complexities, which is determined through the completion of the specific task designed for that specific difficulty or complexity.